Hi and welcome to my book review on Trauma to PTSD, Root Causes to Healing Branches. Today I have Dr. Jessica Samaroo, Daryn Jaggernauth, and Dr. Kanta joining me for this book review. So first of all, I want to say a special thanks to each and every one of you guys for joining in tonight, as well as for being part of my review team. So each one of you guys had the opportunity to basically read my book before everybody else has access to it and give me a little bit of feedback. But I also wanted to do it sort of as a group because everyone had an opportunity to do it individually versus now we have a chance to do it as a group. So everybody might get something different out of it. And it's always a good opportunity to connect each other. So for example, come to figure out, we actually all have some connection to Trinidad right now. So it's pretty cool that it worked out this way. So off to my first question, right? I just want each of you guys to go around, and while you introduce yourself, tell me a little bit about what are your thoughts on the topic of trauma and PTSD in general. So you could go ahead and start, Dr. Jess, since I saw your mic already off.
Oh, I just didn't turn it off at all.
That's fine.
But I can start. So hey everyone, I'm Dr. Samaroo. I'm a licensed naturopathic physician and I specialize in integrative mental health. So thoughts on trauma and PTSD. I think it's a topic that is not discussed very much. And I'm really happy that you actually wrote this book, Dr. Radley. It's so needed, especially, you know, being in Trinidad on the islands. Trauma is so rampant and it's just mental health in general. It's not discussed. So having this open discussion, you know, bringing awareness to this topic is absolutely needed. PTSD on the whole, I think, is a topic that definitely needs more awareness because there's so many aspects to it, right? There's a PTSD that we think about with combat veterans, and that's more so of the hypervigilance, the night terrors, things like that, but it gets more in depth. So for me particularly, I specialize in trauma, and the patients that I see, the population that I work with, they more so have complex PTSD. And I was really happy to see in the book that you explained, you know, simple PTSD versus complex PTSD and the various symptoms that people experience. So it was really nice just shedding awareness on that. And yeah, I think that you are going to help so many people with this topic. And I am willing to, you know, help you spread awareness. So thank you.
Thank you, Dr. Samaroo. Next, I'd ask Dr. Kanta.
Hi, good day, Radley. So to see you again.
Good to see you.
Good day, the rest of co-presenters. My name is Kanta Budhooram. I'm a medical doctor working in Trinidad and Tobago as a general practitioner, also in the field of family practice as well. So in our experience with trauma, and especially in the private practice setting, as a general practitioner, it is not really related with veterans or individuals who had war or any significant natural disasters. Well, you all are from Trinidad, so you all would be aware that Trinidad and Tobago is in a Goldilocks zone, whereby we don't have significant natural disasters or any significant turmoil or any conflicts of that nature. Right, but what we do see a lot of in our setting is a lot of domestic abuse, and also it may not always be acute in that of a single high intensity incident such as an assault or a robbery or things of that nature. It may, most of the time, it tends to revolve around the chronic long-term types of abuse, in that you would see people that are living in very abusive families for a long period of time. They tend to be very restrictive, or they tend to, well, we see them on the two extremes. So either they may be hyper, something wrong with my video here. Hello?
Yeah, we're hearing you.
Oh, okay. Well, I lost. All right. Well, so they either tend to be very on the submissive or the quiet end, or they tend to also be on the hyper aggressive or the hyper vigilant, as Dr. Jessica was mentioning. So, in our exposures to them, we do see them, but not in the very acute setting. So, mostly prolonged trauma over a long period of time, dealing with family issues, abusive spouses, also we are also seeing a lot of people who lost their jobs or the other primary forms of income, and it's been a real experience. Also, notably, a lot of also psychological stressors such as panic disorders tend to also be flaring up. Also, individuals with underlying psychotic disorders as well too. It seems to be flaring up as well within the lockdown, within the perspective of the lockdown itself. So all those are things that we have to deal with in the private practice setting. In terms of your book, I think your book is very well written. I also like it has it wasn't bogged down by too much jargon. It's very easy to follow. It's very easy to read. What I like particularly about the book was the chart regarding how to recognize abusers and also how to recognize those who were being abused. And the red, green, and yellow
The cycle of
colors.
abuse.
Yeah, I thought that was pretty interesting. I never really encountered like that, but I think it was easy to follow, and that part particularly stuck with me, and I think that was pretty good.
So thank you again for sharing that, Dr. Kanta. So Daryn, would you like to take it away now?
Absolutely. Thank you so kindly. And so in reference to trauma, before I get started, Daryn Jaggernauth, I work in academia as well as I have a pastoral background. And so in terms of trauma, as indicated by Dr. Jessica and Dr. Kanta, or where they were highlighting this is just PTSD. I'm familiar with the terminology coming from a military background and so on. So, you know, I'm accustomed to hearing that with folks returning from war and so on. And then Dr. Radley, the way he introduced or started talking about trauma, and pretty much he's done a remarkable job explaining and shedding light on a subject that I believe needs to be talked about more. As indicated earlier too, excuse me. I apologize. And so, you know, coming from the islands is something we don't talk about, we don't discuss, it's taboo, that sort of thing. And so I think just bringing it to the forefront is really needed. And what I like about the way it's presented is that even a lay person can understand it, as well as clinicians can utilize it, you know, in however it's used in your field. And so the more it's addressed, the more trauma is addressed, the possibility for healing is there. And what I like about it too is that even just a regular person, you know, I mentioned this a little while ago, a regular person reading through it will be able to get some sort of knowledge from it and run with it. And, you know, obviously they're not making, you know, they're not able to diagnose themselves, and certainly we don't want them to do that, right? But at least have the knowledge and then says, hey, okay, maybe I do need to address this and I can take this to whoever it is. So those are my thoughts. Thank you so much.
Thank you for sharing. And that was one of my biggest goals with the book. Actually, when I met the publisher and I reached out to her about writing the book, her first question actually was, who do I want to be my target audience for the book? And my book stems from my thesis. I actually wrote my thesis for my doctorate on understanding and treating PTSD from a naturopathic perspective. And I sort of built it from there. And then in addition to seeing patients and learning from different patients, the way that trauma presents to them, and the ways that they miss it and they don't necessarily recognize it is what sort of inspired me towards doing the book. Initially, I was going with the approach of writing it more scientific based and continuing where my thesis left off. I also wrote an article for NDNR, also science-based, and I wrote an article that allowed me to win a scholarship through my Acupuncture Institute on how to utilize acupuncture to help with PTSD. So that allowed me the opportunity to go to China to study a little bit more for acupuncture. Unfortunately, it was only 2 weeks, but it was still good. So all my writings in the past in terms of like PTSD and trauma has all been sort of science-based. And while I found that it was easy for people to understand from a science background, I found that if I keep it at that level, not enough people would be reached about the actual topic. So like you mentioned, and like all of you guys mentioned, the simplicity of it is what my goal really was. I wanted it to target everybody. I wanted it to become such an easy topic to talk about, to understand that you would be comfortable enough to go to your healthcare provider, whoever you choose to see, that you would feel comfortable enough to say, listen, I identify these things as being potential issues in my life and these as being like past traumas that I've dealt with. Do you think this is something that you could help me with? And me writing this book is not so much for self-promotion, it's actually more so promotion of the topic itself, because I know I do see a lot of patients who've been affected by some degree of trauma or some degree of PTSD. They don't necessarily admit to it, or they've never been formally diagnosed. So they don't understand that the trauma that they've been through, the PTSD that they've experienced, are actually causing some of their health issues. So like I said, the goal is to bring that awareness to people to help reduce the stigmatization towards the topic of trauma, PTSD, and mental health as a general topic. And all of us here have some connections to Trinidad, and we all know that our culture has always had some sort of stigma towards it. I mean, it has been changing, and I would definitely say it's changed a lot from the time I was in primary school till now, but there's still a lot of growing to do. And it's the same thing even internationally. Being able to study in Florida, being able to study in Connecticut, being able to be in the military, you still see that stigma. And it's even in the military where PTSD is more common, there's still like a huge stigma associated with it. Apart from that, I wanted to talk about in the book itself a lot of risk factors that cause people to develop PTSD, because a lot of times people go into the military, they go through X, Y, and Z, and then sometimes it's a simple thing that triggers the biggest issue for them, and they don't take into account the history of trauma that they've been through. So one of my goals with the book was to highlight those types of traumas that are not necessarily the common ones that we expect. Understand, especially for military personnel or persons who are in high-risk jobs, understand what their past traumas have been, what their past experiences have been, how could that actually increase the risk of them developing PTSD as a whole. So that's a little bit about my take on the book and my goal on the book. I know some of you all started touching on it, but I just wanted to get your feedback on the book as a whole. So you want to go, Dr. Just?
Sure. So, I mean, do you want me to like highlight my favorite parts of the book?
Oh, we'll do the favorite part after. I just want you to tell me what are your general thoughts about the book itself.
So I think Daryn mentioned this, but I thought that it was really applicable to practitioners and patients alike. You know, it was a very simple read. I liked that it wasn't, 500 pages long. You got to the point in like, I think it was 60 something pages.
The published version, it would be about 100 and something pages, but it's
okay, that's still fine.
Still not 500.
Yeah, it's still not 500. So I was actually able to like get through all of it in a relatively short amount of time. So that was really cool. And the organization of the book, one of the first things that captured my attention, right? You went into the 6 foundational aspects of health, right? The physical, the mental, the emotional, spiritual, etc. And I think that's so important for people to understand, because when we talk about trauma and mental health, we just focus on that aspect of health, not knowing that, you know, the physical, if our physical body is not up to par, or there's some problems, digestive issues, hormone issues, that can also exacerbate what we're experiencing. So I love that you went into depth about that. You did a nice job of explaining the ways in which our naturopathic philosophies, right, our 6 naturopathic principles, can be incorporated to help us heal and overcome and recover from trauma, which was really cool because naturopathic medicine is not well known, especially in Trinidad. I'm glad, you know, you're affiliating with Dr. Kanta and he's referring you to his patients. Like, my goal in life is to make naturopathic medicine known. So I'm so happy that like you put that at the forefront of the book and make it, spread an awareness as to like all of these different modalities that exist out there that can help the body heal. You know, it's not just about medications. Medications absolutely has a place, right, and a role with trauma, but it's not the only thing. There's so many more modalities that we can utilize. Yeah, overall, the book was extremely well written, concise, and yeah, I enjoyed it. I don't know what else to say. I can give you highlights. I can give you my favorite parts, but I guess that's coming after.
Yeah.
Okay.
All right. Daryn, you want to tell me a little bit about your thoughts on the book?
Sure, thank you. And so I have to go back with this again, that point of, you know, not having a background as each and every one of you on here, just a regular person. The idea or the ability just to read through the text and understand it simply because you highlight a topic and you expound on it in such a way that any person just can read through it. I think that speaks volume for the text. And again, the examples that you give, you know, and you dig a little deeper into stuff and then you just keep going through it like that. I think that was really helpful. Yeah, though that's really the big take for me. I can't get over that part, you know. It just and just keep coming back to me. It's just how you just put it together and straight to the point, as Dr. Jessica just said, straight to the point. I think, you know, we have a lot, there are a lot of stuff that's out there, and I'm not a professional in this area. And sometimes you have to get to page 25 just to even start getting an idea of where we're going. But from the very beginning, you laid it out structurally, remarkable. So thank you so much.
Thank you, Daryn. Dr. Kanta, your thoughts or your general thoughts on the book?
I think what was said before by Dr. Jessica and Mr. Daryn pretty surmises what I was also thinking as well. But Mr. Daryn said one thing that he probably had about in relation to the book. He said he wasn't an expert, and that may be so, but it is because of that particular notion that other people are not experts, but so they may not feel confident to comment on issues that may not be within their realm of academia or experience or exposures. But I think the book serves to help bridge that gap between being an expert and also being somebody that is able to get a firm grasp of, if not the nitty-gritty of the content, such as the psychological diagnoses and the timelines, the time frames, and all these stuff, but at least to get a grasp of the core concepts that would precipitate post-traumatic stress disorders and also other disorders within that realm. So I think the book serves to really do that by being simple. It also got to the core principles of what you wanted to put across without getting overly into the depths of medicine and psychiatry and psychologies and stuff like that. So I think the book did a pretty good job of doing that. In psychiatry, I think there was something in line with these pillars of health. There's something called the axes, basically that behind behind psychological disorders, there are axes in that, and each axis represent an exacerbating factor. So I can't remember the exact order, but it goes along the lines of a person being predisposed to certain psychiatric issues, and then which would be also like genetics and whatnot. Also their health as well too, their environment, that where they're working or where they're living, and another one I can't seem to remember it, but it's along the lines of different stages of a person and the environment helps precipitate these psychological. So, well, war especially would be a pretty significant stressor for sure. So, but in the concept of the pillars of health and what you mentioned in the book, I think that was a useful analog in terms of how to strengthen oneself and how to strengthen one's personal environment to help better protect their mind from going down the lines of the post-traumatic stress and syndromes and disorders along those lines.
So while you're there, I'm also going to ask you the next question. What's your favorite part of the book?
Oh, my favorite. I think the whole book was pretty good. The whole book was my favorite part. But if you want to get down to a specific part, certainly the chart regarding the abuser and the person being abused, that was pretty informative, and it was pretty well laid out. And I actually did learn a bit about the PTSD in terms of that, identifying. We always, from our perspective, we tend to look for diagnosing the problems of the person, in that what are the criteria that this patient should have to fit post-traumatic stress disorder or anything similar to it. But in terms of identifying and the person causing the abuse, that was something that we never really touched on. So that in particular was very informative, and the cycle of the stress and how it could come back onto the person when they think they are getting out of a situation, when really and truly it's just a lull in the whole trauma experience, whereby they fall back into this loop again. And that was pretty informative to me as an individual and as a physician as well, and that we always see people in our practice, and we did tend to focus on their pathologies as an individual, and also, well, we may not have as much power in terms of their family life or their social background, but it is good, at least in that we could inform them and make them aware of it, so they could put things in place or take the necessary steps in a positive direction. So that was pretty good for me.
Thank you for sharing, Dr. Kanta. Dr. Jess, you want to tell me your favorite part of the book?
Sure. So I actually had a couple parts of the book where I really enjoyed and I learned a lot. So you know that I am into mental health. I specialize in mental health, but you can't know everything, right? So one of the really interesting things that I learned from this book was the different, I think it was survivor types, correct me if I'm wrong, but the different survivor types, right? So there's the fighter, the victim, and there's victim mentality that a lot of trauma survivors have. And for me, what I learned, the fourth one that you described was those who made it, right? That's like more of the person who came out on the other side. They're more resilient. And I thought that was interesting because I do have a personal history of childhood trauma. And it gave a lot of perspective to me as to where I fit on that spectrum. So thank you for shedding light on that. I liked that you talked about transgenerational trauma, because that's something that we don't fully understand. A lot of us don't understand, you know, we don't know about it. And kids are being born into this generation, you know, with anxiety, with depression, with suicidality, and they don't necessarily understand why. You know, they may have a solid upbringing, but they still have these mental health conditions, and transgenerational trauma could be the explanation for that. And you went into depth as to how we can end that cycle, right? So I really, really enjoyed reading about that. What else did I like? There were so many things. So you included a lot of tools, which I thought was very helpful. So identifying the triggers, right? Helping people to identify their emotional triggers, writing them down, and then keeping track of that. If we're not, one of my favorite quotes is, you cannot change a problem with the same consciousness that created it. So if you're trying to change something, right, you have to have an awareness of what that is before you're able to change a behavior or change a habit. So that was really cool. And the last thing that I wanted to highlight was boundaries. I think boundary setting, a lot of us were just, you know, we have no boundaries. It's difficult to say no to things. And you went into great depth about the different types of boundaries that exist, right? Physical, financial, intellectual, personal, all of these different boundaries that we don't necessarily think about. And you gave just great analogies. So I'm gonna steal some of it with your permission, of course. Yeah, so those were, I guess, my favorite parts of your book.
Okay. And Daryn, what were your favorite parts of the book?
Well, thank you, Dr. Jessica,
Of course.
for mentioning boundaries. You know, I mentioned the other my other profession, pastoral ministry and ministry and so on, and it's in general, the information that Dr. Radley provided can be used in so many different fields. It's, you know, so it's useful certainly in my in that professional as well, my profession. But in terms of boundaries, your ability just to go in depth and highlight it, as Dr. Jessica stated, and break it down from the emotional to intellectual, spiritual, and how they impact each other. You know, it's it just speaks volume to how much we know and perhaps don't know as well. When, you know, the word no, the ability to use that word, and it's such a small word, but it's profound when used in whatever ways, right? And so just your ability to break it down and just spell it out for the lay person like myself, I mean, it's huge. And so that was one of my favorite parts. Secondly, learning about that. The worksheets that you provided, I'm like, this guy is really cool. I mean, you go in depth with your subject matter, and then you provide something for whoever it is that's going through the text to, you know, to apply whatever it is. And so I thought that was really neat. Yeah, that's about it. But certainly the boundaries, and the reason I keep highlighting that is because, you know, there was an experience I had when I was much younger, trauma that I experienced, and I'm reading through this, and I'm like, okay, now I can see why this and that and the other and so on, and it makes sense. You know, stuff that happened in your past certainly affects your future, you know, can affect your future, certainly your present state, and from your spiritual, even your time, how you interact with other people. And so it was an eye-opener, just learning the different ways to classify boundaries and so on. You know, in general, you think boundaries is just, you know, your space and that's it, leave me alone, but there's so much more. So thank you.
No problem. I'm actually going to keep you on, but I'm going to share my screen to ask one question that I didn't tell you guys about before. but I do have one more question for you guys. Hi, Kerry, are you there? Do you hear us, Kerry?
Yes, I'm trying to figure it out for my phone. Sorry.
Oh, that's all right. All right.
Oh, but hear me. Okay, that's good.
All right. So I know, Kerry, you were on the live on the day, and you did share. So basically what we have done so far is we've sort of asked the questions of what are your thoughts on the topic of trauma and PTSD, your thoughts of the book, and then your favorite part of the book. So I'm gonna hand it over to you before I ask my next final question.
Okay, so first question, thoughts on PTSD, right?
Yeah.
Okay. I think that it's a really misunderstood topic. Like, even as I was reading through your book, and I thought I had like a pretty solid grasp and understanding of it, I was like, oh, there's things that I didn't know. There's things that I should learn. There's things that we should all learn. So I think, like, just from being someone who like goes to therapy and who considers, you know, like I would consider myself to be a very big mental health advocate, I still was like, wow, like there's topics that I just, or little things or details that I just didn't understand or I didn't think about. So I think in general, like it's misunderstood. And I don't think it's talked about often enough. And that's why it's so misunderstood, is that like people don't, I don't know, it's not something that people talk about enough. So it doesn't bring about the conversation. So yeah, I think it needs to be, because so many people probably suffer from some form of, whether it's small, whether it's on a larger scale. I know in your book you called it something, I think it was like complex, and I forget the other one, but some like different forms of PTSD, right?
Mm-hmm.
Yeah, and I just feel like so many people probably struggle with forms of that, or just forms of trauma, and without knowing that, can't get the help that they need. So yeah, those are my thoughts on it. I think it's misunderstood and needs to be talked about more often.
Thank you. And what would you say is your favorite part of the book?
I know I'm going to repeat myself because I said this in my review, but my favorite part was talking about boundaries, because I think for everyone, not just people who have experienced trauma or who have PTSD, all of us need to get better at setting boundaries with the people in our lives, because it's an important way of like protecting ourselves. And that's something I'm working on in therapy. So reading that and like recognizing how like my trauma in my childhood has led to me not being able to set boundaries, I was like, oh my gosh, like this is crazy. So that for me, I just like a personal reason, that was my favorite part of the book, was that when you like talked about like, okay, picture a wall. How do you want this situation to be? Do you want the wall to be like hard? Do you want it to be completely open? And what I love the most is I'm a very black and white thinker. It's something I work really hard at. I don't want to say controlling, but like managing my reactions to things. And I love that you mentioned that for most situations, it's not black or white. It's not going to be a hard wall. It's not going to be completely open. There's going to be some like fluctuation. And I was like, oh, I love that, because I needed to hear that. So that was definitely my favorite part.
Okay. So thank you for sharing that, Kerry. And Kerry, this is Dr. Kanta, Daryn, and Dr. Jessica. They all have connections to Trinidad, and to all of you guys, Kerry also has connections to Trinidad, because she actually just got married to my brother. So,
Yay!
Wow.
so it's still technically a full, I guess, Trinidad team, connections to Trinidad, who's on this review.
I would consider myself an expert on Trinidad things. No, not really, but we're getting there. And we're planning on having a Hindu wedding soon, so that's exciting.
Looking forward to that part. So all of you guys shared a little bit about your favorite part. I wanted to share what my favorite part of the book was, and it was actually the part that talked about comfort in trauma. And basically, this was the toughest part of the book for me to write personally, because it is something that I have experienced, and a lot of people experience and don't realize it. And that was one of the reasons I thought that it's important to include it into the book. So basically, with comfort in trauma is where you get so comfortable with whatever situation or traumatic situation that you don't recognize that you're stuck in the cycle of trauma, more or less. I served 6 years in the military. I had the opportunity to serve 1 year in Kuwait and Iraq. And being in the military has its trauma that's associated with it. So in my case, being overseas and living in a traumatic situation for an entire year, you create sort of like an adaptive survival skill. You create a comfort within that area that you find any little thing to become sort of your comfort. And it's really just your survival skills, because we're all built to survive. And I found that that is what I did. And I didn't realize that is what I was doing until in school, people started pointing it out to me that something's wrong. Like I have changed from who I was before I left. I left school in what was supposed to be my last year of medical school to go on to deployment. And in the previous session earlier, I had one of the sergeants who was there as well. And he also mentioned similar stories that we tell ourselves that we go in overseas and when we come back home, we're going to be the same person that left. And I came back home singing that same tune every single day, that nothing changed, I'm fine. And you start experiencing certain things, very little things, sometimes very subtle things, that you don't realize that you still live in that cycle of trauma.
You just tuned out, Radley, we can't hear you.
Hi, and welcome back to a continuation of the video. So basically what has happened was I sort of lost connection and unfortunately unable to get the recordings for the remainder of the review. But I wanted to continue on and just share a little bit more information. We did actually go through with the preferred cover style, and similarly to earlier, there was a difference in preference for the books, again, sort of showing similar opportunity of how it varied in terms of the view of the book, and again, using that same example. So I wanted to take another opportunity to share some of the general book reviews that I got from the team as a whole. We've had an opportunity today to meet a couple different ones, individuals who have been part of the review team, but I also wanted to share a couple words from everybody in total. So Pastor Gerald Edwards, Staff Sergeant of the U.S. Army, he was on the meeting today, and he shared a lot of his information and insight of the book. But something that he mentioned in the written review was that this book will help me in communicating more effectively with individuals dealing with PTSD. Very informative. Dr. Zara, she's a naturopathic doctor as well. She wasn't able to join in, so she mentioned even if you do not think you've been through trauma, this book will give an understanding that will lead readers to more fulfilling relationships and greater understanding of the people in their lives. Dr. Nikita Patel, she mentioned that this book this brings hope to thrive, not just survive. Dr. Cleveland Job, she mentioned that he points out not just the trauma that are easily recognized, but also the subtle ones we don't. Daryn Jaggernauth, we've had an opportunity to meet him as well. He mentioned there is something that everyone can learn from trauma to PTSD. Dr. Kiertin DeWitt, we've also had an opportunity to meet her today. And she mentioned this book is foundational for both those with PTSD and those who may know or work with those with PTSD. Dr. Zara, she mentioned it appeals to pathos and gives us hope for the future. Dr. Victoria Chan, she's the founder of the Banish anxiety method. She mentioned it's easy to follow and understand, highlights points that need to be more well known because it can be the make or break factor for some people and their communities healing. Dr. Mansi Vira, she was able to join us and again earlier. The worksheets are also such powerful tools that help us start to assess our past, understand the complexities involved in our traumatic experiences and ultimately learn how to begin to heal. Dr. Stephanie Draus, she was also my advisor for my thesis, which is part of my journey towards writing this book. And after giving her the opportunity to be part of the review team for the book as well, she stated that outstanding sections, including the chapter on boundaries and the chapters dealing with transgenerational, intergenerational trauma and social justice, the worksheets for triggers and the worksheets to develop a plan for dealing with triggers were also quite good. Dr. Jennifer Botwick, she mentioned that his book integrates important aspects of conventional and holistic modalities, which with few exceptions is lacking in the choices and success of treatment programs and options. Kerryn Bakken, we've had an opportunity to meet her as well, and I'm just going to repeat because she mentioned it there. I especially love the part about boundaries, the porous, the hard boundaries, picturing a wall, then picking a situation and deciding what the wall should look like. Really helpful. Dr. Kanta Budhooram, we had a chance again to meet him as well. Very well written, conversational, and easy to follow. And last but by no means least, Coach Kai. He works a lot with individuals, helping them with boundaries and stuff like that. So Dr. Kai mentioned, so informative. I love how you are able to describe trauma-related concepts through simple stories and analogies. So I would be sharing the contact information if anyone would like to work with any one of these doctors or individuals who've been part of the review team. Their contact information would be in the description as well. So once again, I want to say a special thanks to each and everyone who has been part of this review team. Without you guys, I wouldn't have been able to get to the point of who I am. And I'm grateful for each one of you guys being part of this journey. So my contact information, again, the information on the website for the book would be www.traumatoptsd.com. My Facebook and Instagram pages are both Universal Tree Health Clinic. My email is universaltreehc@gmail.com. And again, you're here to have an opportunity to view this video on YouTube. You could follow and subscribe to Dr. Radley Ramdhan. So once again, I want to say thank you to each and everyone for taking their time to be part of this journey for my book. I want to say a special thanks to each and everyone who has been part of the team from day one in terms of doing my thesis, will support me through my thesis all the way till my journey of actually getting this book published. So special thanks to each and everyone who have been part of this team. Thank you again, and have a great day.